became a nurse because I want to help people and I have a fascination with the human body. I've been a massage therapist for several years and the musculoskeletal system was always very fascinating and I wanted to challenge myself and learn more.
I remember when I was in 7th grade taking those career aptitude tests and I got that I needed to be a nurse. And I remember thinking that was kind of silly, but began working in healthcare and working with the nurses and really having that become a passion of mine.
When I was younger, I wanted to be a doctor, and then I realized I didn't want to go to school forever. So I became a nurse, which I actually think is kind of better because you get to be the eyes and ears for the doctors and you actually get to connect with the patients.
What attracted me to nursing was the thought of being able to help people.
I work in the neonatal intensive care unit. I'm also a neonatal flight team member. I had my first baby as a premature infant, and I was working adult intensive care unit at the time. And when he was 7 months old, I decided that was kind of where my passion and my focus was, and he is now a senior in high school. So I guess I have decided I like that unit.
When I was little, I used to carry around my baby dolls, and if I ever knocked their heads on something or dropped them, I would be absolutely traumatized that I hurt them. I was always trying to fix them and turn to my mom for reassurance that everything was going to be okay and that I did a good job taking care of them, and that kind of carried through my teenage years into adulthood, and I just have really had a passion for always wanting to be able to fix others.
When I was in high school, I took care of a little boy who was deaf and diabetic, and I always thought it was so fascinating how they cared for him having a insulin pump and how they worked it, and I think that's what really sparked my interest in nursing.
I started to think about a nursing career in high school when I started to work as a caregiver in an assisted living home.
I was a housekeeper at St. John's and a resident needed help being fed, and I did not have the certification to do this, so I asked my boss if I could do CNA work, and she put me through the program at St. John's, and I got my license there, and I cleaned, and I did CNA work there.
I was born and raised on the Crow Reservation, and I really wanted a job that I could come home and help my people.
I had a man who was on a vent, and he couldn't have a lot of family members. So we arranged for all of his families and friends to be out in the waiting room. And when he came around that, the corner, basically, they started just singing for He's a Jolly Good Fellow and Happy Birthday, and I don't think anybody had a dry eye.
One of my first experiences was when I was working in the clinic, and I took my patient back, and I realized that I had taken care of her husband as a CNA the night that he had passed away, and just the connection that was there between her and her husband and I was just so special to see her again.
I feel like one of the ones that touches your heart the most is your first loss. I feel like you never forget the pain in the parents' eyes and the impact that they had on you.
One of my first experiences was probably right before I started nursing school. I traveled with Harvest Church to Ethiopia and did a medical mission trip there. We saw close to 900 people in 4 days.
I remember there was an elderly lady that would come in, and this is when I was an inpatient, and I loved to bead, and she also loved to bead too. So, after we finished doing our evening routines, I worked nights mostly, we would just sit there and talk about beading, and so it was really special to me.
I remember once I had a patient who was in a traumatic accident and had broken his neck, and he was a diabetic, and his blood sugar went extremely low, and rushing to get him some peanut butter and some milk and just being terrified.
What I like about my job is the bonds that you form, the bonds that I have with my teammates, the bonds that I have with my patients. It's just amazing.
I really like orthopedics because people typically get better. If they're a trauma or if they break something, the surgeons will fix it and then they get to go home.
So I really love how I was able to collaborate with other healthcare facilities and the Crow tribe. We collaborated and had some really awesome educational and cultural sessions.
I love the people I work with. That's what I like most about my job.
I love that I get to work with kids on a daily basis, so it's the simple things, whether it gets to be painting their nails, taking them outside to be in the sunshine, just letting them be a kid.
I love old people. The elderly are my life.
Being on the neonatal flight team and always being an intensive care nurse, I am an adrenaline junkie. So I really like those very tricky, sick patients that I can use my brain and think.
When I was a CNA, I got tricked into doing an EKG on a person who wasn't alive.
This gentleman had some lactulose, and he needed this for his body. Well, I didn't know, it's like syrup. I mean, thick Carol syrup. I, automatically feel that you have to shake it up. Well, someone didn't put the lid on it the last time that they used it, and the resident was in the bathroom when he came out. I had all of it over my hair, all over his mirror, all over the counter, all the way down the front of me, and all we could do was laugh.
One funny moment I remember was with a gentleman who had a great sense of humor, thankfully. I was asking him about his feet, if he had any numbness or tingling, and he had just recently had an amputation. And so we laughed for a good while about that, thankfully.
I had a grandma one time that was really confused, but she remembered her doctor. And she threw her water bottle into the hallway one time. And I went in there and I said, "Did you just throw that in the hallway?" And she goes, "With these hands, do that?"
Finishing RN school with 3 young boys at home, it was not easy.
My greatest accomplishments in life are my kids.
Graduating and getting my foot into the door was a really big accomplishment for me.
When I get to see a patient that I discharged several years ago and they come back and they're like, "I remember you helped me take my first step," or "You were there when my baby came off the ventilator and was able to take their first breath on their own." I feel like those are some of the things that make your job so rewarding.
3 years ago, I lost my mother, and then 6 months later, I lost my sister. And I was just at the lowest point in my life, like no hope. And being able to come back from that and continue on with my nursing career, be a mother, be a wife, and also enjoy my beading and trail running, that has been my greatest accomplishment in life.
But I'm hoping my greatest accomplishment is yet to come. I have applied to neonatal nurse practitioner school, so we'll see. Stay tuned.
I'd say that I try to emulate my mother and to try to have a positive attitude and to take my responsibilities seriously, but not myself.
I think the way I inspire others is by educating them and, working my way up from being a CNA to a nurse, showing that it's possible.
By just showing the passion that I have for what I do and showing passion for my work.
I try to have a positive attitude to inspire others. A happy attitude and a smile is very infectious.
Being open-minded about each situation that I am put into.
I wake up every morning thinking it's a new day and there is so much I can do, and I'm going to try to do it.
If it's in your heart where you're at, it's not a hard job at all.
In nursing, you don't have to know everything or know all the answers. You just need to know where to find the answers to educate yourself.
Probably the best advice I could give somebody is it's not about you.
Be flexible, always learn, and always be compassionate to your patients.
Sometimes in those really scary situations, in the moment, just go for it, and then afterwards come back and go, what just happened?
Never give up. You can always work through it. Tomorrow is a new day.
I walk into each room with a smile on my face just to greet the patients and really just listening to the patients and their concerns.
I do the life-saving thing first, and then I get to know my patient. Whether they like to read books or they like to travel, I connect with them that way.
I always think of them as a family member. If I have an older lady, I always think of it as my grandma. If I have a younger kid, I think of it as a cousin or a brother.
And I try to give them what they need before they even know that they need it.
be kind, for everyone you meet is fighting a battle that you know nothing about.
Everybody's doing the best they can with what they have.
Well, the residents know I'm there in the morning when I turn on the lights and say, "Good morning, America."
Sometimes I find myself saying, oh my gosh, is this really happening right now?
If it's wet and not yours, use a glove or don't touch it.
Proper planning prevents piss poor performance.
You got to remember why you started. Most of us that go into nursing are because we are compassionate people and we care for others, and so you have to remember that. And remember that, especially with this whole COVID-19, it's going to pass, and we are people who can make an impact.
It takes a lot of resiliency and ability to stay calm in hectic situations.
It takes a lot of dedication, teamwork, and just knowing that you have the best team surrounding you, so it's relying on one another for support.
It takes a lot of patience to be a nurse right now. And it takes a lot of adaptation right now to be a nurse.
I think as long as we stick together and know that it's going to get better and back to normal, then we'll all be okay.
You can do the smallest thing and impact somebody's life so big.
Every day I leave my job knowing that I made a difference in someone's life.
Such an honor to be a part of people's stories, that people let you into their most vulnerable times in their life.
It takes a lot of prayer and love.